Hello everyone, welcome back for another YouTube video. My name is Brittney with SMNP Reviews, and today we are going to review some of the differences between Medicare and Medicaid. These are important to know for your exams, but also your future practice. While professional rule content is more heavily tested by ANCC, it is fair game for either exam, so make sure to review this content for whichever exam you take. Let's get started with Medicare. So who is typically covered under Medicare? A good way to remember this is that we care for older adults and patients with certain disabilities. So this would include adults who are 65 years old or older, and some of the examples of disabilities covered under Medicare would include end-stage kidney failure, cancer, and some musculoskeletal and neuro conditions such as multiple sclerosis or amyotrophic lateral sclerosis or ALS. Now, how is Medicare funded? Medicare is funded at the federal level. So there are several parts of Medicare as well. We've got Part A, B, C, and D. Let's go over what is covered in each of these parts. Part A covers all inpatient services and skilled nursing facilities. This will also include hospice care. One thing that helps me remember this is to think our inpatient services are the most acute, and acute starts with A, so they come first. Part B covers outpatient services like dialysis and would also cover things like second opinions, preventative screenings, and medical equipment. Part C is what is known as the Medicare Advantage Plan, and this is a supplemental coverage for things like dental, hearing, and vision. Our last part, Part D, covers prescription medication, so you can think D for drugs. On to Medicaid next. How is Medicaid funded? Medicaid is funded at the federal and state level. Who would we expect to utilize Medicaid services? Those who are not able to afford health insurance. So a good way to remember this one is that we aid those with lower income. Let's go over a couple extra items under Medicaid that would be good to know for practice and for exams. Does Medicaid coverage differ depending on where the patient lives? Yes, because Medicaid is funded at the federal and state level, there are some differences in coverage from state to state. Now, what happens when a family does not technically meet criteria for Medicaid, but still needs health insurance assistance for their children? In this case, the children specifically would be covered under a program called CHIP, or the Children's Health Insurance Program. Okay, we are going to apply what we've learned with a practice question. Just a good rule of thumb while you're studying, once you've reviewed certain content, it's always a good idea to go through some practice questions to help the information stick. Here is the scenario. The nurse practitioner is conducting a follow-up appointment with a 67-year-old patient. Despite lifestyle modifications, the patient continues with elevated blood pressure measurements. The nurse practitioner decides to prescribe medication with this visit. Which part of Medicare would cover prescription medications for this patient? So our options here are Medicare Part A, Part B, Part C, or Part D. Do you remember which one covers prescriptions? Okay, let's review one more time. Medicare Part A covers inpatient services and hospice. Remember, the most acute comes first. What is covered under Part B? Outpatient services, second opinions, preventative health and screenings, and medical equipment. Part C are those supplemental insurance like hearing and vision. And Part D covers what? Drugs, right? D for drugs, so prescription medications. So the correct answer here is Part D. And here are the references used for this video. This non-clinical content and professional role content can make some students feel a little overwhelmed, but breaking it down into smaller sections can help us clear up the confusion. It is important to know what options we can give our patients as far as programs or benefits they may qualify for. It is all part of becoming that real deal nurse practitioner. If you would like a deeper dive into different parts of the non-clinical content, I would highly suggest checking out our review courses. And make sure to hit subscribe here so you can stay up to date on our newest content. See you next time.